Welcome to Adoption and Usability. We're going to discuss some basic human behavior changes and adaptation strategies and how you can apply those to some of the adoption and usability that you may come across with any process improvement project. So identify some frequently encountered challenges, propose solutions, and how you can use strategies to design a plan not just to implement in health information technology, but implement any new process improvement project. So why do systems fail? If you recall back in the Institutes of Medicine report, good people were working in a bad system. Well, why did the system fail? Why did the system get in the way of providers and physicians being able to do good care? Narratives are a big one. The poor communication not being received. As you know, the message being sent was not the one received. The structure of the patient's record. So a narrative is how the physicians are trained. If anybody's watched the new TV show 911 or any other drama on TV about healthcare, you'll sometimes hear them give a patient report and they'll say something like 66-year-old male complaining of chest pain onset an hour ago while he was shoveling. It's sharp and stabbing. It was 5 out of 10. Now it's 10 out of 10 and it's now radiating to his back. He has a history of hypertension and diabetes and is on hypertension medication. That's a narrative. That's a story. You found out a little bit about the patient themselves. You know how long they've had this episode going on, this present illness has been going on for an hour. You understand how it's been changing. It started off not so painful, now it's more painful. All of that's a narration. Another narration is a patient summary where you're getting a snapshot of somebody potentially that came in, maybe they came into the ER, they were short of breath and they were diagnosed with pneumonia and they have a plan of care to go home and be discharged. You need to be able to see that quickly. Over the course of 3 days, there have been nurses and therapists and physicians all documenting in this record, but you just need the snapshot of the story that says they came in with complaining of shortness of breath. They were diagnosed with pneumonia. They were put on antibiotics, admitted to the hospital for observation for 3 days. They've improved. Their last chest x-ray looked really good, and they're on their way home by noon. That's what you need to see. Sometimes that gets lost in all the check boxes we're clicking. So narratives, you heard how fast and quickly I was able to say both of those things. It's a lot slower when you're trying to hunt and peck through check boxes. So that was part of the problem. Systems back in the day, even though they could do text to speech like Dragon, naturally speaking, if you recall, the data couldn't be pulled back out. The data needed to be codified or discrete data, and we couldn't do that up until a few years ago very well with text to speech. That has since improved. So now we're able to give them that opportunity to do more of that dictation type narrative as opposed to click and check the box. Some other success factors. Think about if you're going to offer some training to somebody, and again, it doesn't matter if it's in health information technology or anywhere else. If you're trying to help them learn, you've got to understand their cognitive style, maybe their personality, demographics or culture, their situational variables. So it's cognitive is going to be, are they a left to right person or an up and down person? I'm an up and down. I like to start from the top down and read through a bulleted list. I have people I work with that are very much linear. They like to go from left to right and see a list separated by commas in a sentence. So understanding some of that. Personalities. If you've got a class clown, you might be better off putting all the class clowns in a group together. Maybe you need a class clown in your group of very solemn individuals to help out with. Shy people versus overt people. If you embarrass somebody and try to make them participate, they may withdraw more. So understand their personality. Situational variables. Somebody's going through a divorce. A physician just had their patient die. Maybe somebody's coming off a 36-hour shift when they were only supposed to work 12 hours. All of that can affect how they're going to receive the change information that you're trying to provide. System design characteristics. We've got hardware, software, decision support, usability, GUIs or graphical interfaces. So back in the day, we used to have um, black screens with green text. That was it, folks. If you've never seen something, go watch War Games from like 1980 something. That's really the way the world used to be. Now we've got all these GUIs and ways that you can interact with apps and just touch your screen and move things around. So think about how you can leverage the technology to assist with what you're trying to do in the change or the design. How do people interact with systems today and make mimic that? What's in it for them? You've really got to help them understand how this is going to benefit them. You can't just force them to make a change. So how are they going to see a benefit? Are they going to see more patients in a day? Is it going to be a monetary return on investment? Are they going to get more time back so they can be with their families? They're really going to be able to take every Friday off. They're going to reduce the number of patients that die from a diabetic comorbidity. Hardware and software performance, there is nothing worse than implementing a change and day one that it's going live with that change, you don't have enough devices for the people that need them. Your Wi-Fi, your wireless access points, there's not enough of them. It's not strong enough because you have 20 people all connected. Yeah, you tested it. You tested it with 4 people connected. All of a sudden you've got 20 people connected and not everybody can download and it's slow or they can't do what they need to do or they keep dropping connectivity. Your culture, your top level support, so the organizational characteristics. If you're a person driving one of these process improvements or responsible for implementing some sort of change, there's a good chance that you will have all the responsibility and none of the authority. And by authority, I mean you won't have the ability to threaten somebody's job or hold their paycheck if they don't participate. You probably aren't in a position to go to their manager and say so and so didn't participate. You really need the people at the top who have that authority to support you, so when you have an issue, you know who to go to and they will stand up and they will be the ones that will make sure there is follow through. Commitment. Recently, I was in a meeting where they talked a lot about the vision and the end goal and making sure everybody understood and was on board with that end goal and that you spoke about it often at every meeting, because you can easily lose focus in a 6-month to 2-year project where something else is going to take priority. Someone else is going to want the new shiny thing over here, and your project's only halfway implemented and all the resources are going to be diverted to the new shiny thing. So every day, if you focus on it and realize the expectations and the commitment it's going to take, and you comment about it at your meetings and keep everybody on the focus. So an image board, some sort of progress. That's why people do the thermometers when they're trying to do fundraising. Keep the goal in everybody's mind so you can keep the focus and the commitment to get this done. Hard to enter data. Free text is not hard to enter. We talked about that. Just being able to talk is very easy. Where structured text, you're hunting and pecking, you're trying to read. People read online, particularly 40% slower than they do on paper, or if they're not reading at all. So keep those kinds of things in mind. How can you make it easy for people to enter data, whether it's structured or free text? From technology, make sure their nuance is working really well. Make sure that the free text boxes are in strategic locations in the documentation. The structured text, make sure that it makes sense, whether it's in alphabetical order, so if they have a drop-down list, it's alphabetically, or perhaps the most common items are at the top of that list if they're the ones that are going to be used the most. Data input. So here's an example of multiple name formats. If you've ever typed in your order on Amazon, your address or whatever, and you start to type your name in uppercase and lowercase letters and it switches it all to uppercase, that's actual programming that happens in the back of a computer in the configuration of that program that can switch multiple formats to one format. So that's the one format from that point forward going forward that is used in the database for matching, if you recall back at our database lectures. When you're configuring these systems, think about all the possible ways somebody could enter data. If they're going to enter a yes, are they going to type a capital Y, a lowercase y, the letters Y-E-S in capitals, first letter Y, capital, small letter E-S? Are they going to type in all lowercase Y-E-S? And you need to make sure the system can handle all those forms of data input. Presentation of this primary effect. So we're going to talk a little bit about clinical decision support. It was on your other slide and we didn't talk a whole lot about it, but here's an example. If you're going to present a medication to a provider to select from, if you're going to present them with a clinical decision support, do you want this option or this option? And have them pick it. Understand, as in any communication or professional email that you may have, strategy for writing professional emails, always put the most important information at the top. It should be the first line in any paragraph or sentence, should be the thing that catches their attention. So go ahead and read these two. Which one of these medications would you pick if you were the provider? The correct answer is A, because what do you need it to do for your diabetic patient? You need it to be effective and you need it to lower blood sugar. The fact that they feel better is icing on the cake, and the benefit of them feeling better and lowering their blood sugar outweighs the risk of potentially getting nausea or headache, because they might not get nausea or headache. Medication B, the very first thing it says is may cause headache and nausea. Holy cow, I don't even want to read past that. I'm not even going to read the rest of that paragraph. So think about how you strategically word the responses potentially that you're going to present in front of your providers. Tall man lettering, I think we've talked about this a little bit back with the Institutes of Medicine, but if you notice one of those medications, right here, the first three letters, ACET, you've got acetazolamide and acetohexamide. The difference is the hexamide and the zolamide. So those are what are in capitals. There's more about tall man in your discussion forum, but think about how you can help bold with fonts, with colors, bring things to people's attention to prevent errors. Some of the other challenges with adoption is simply monetary. Who's going to pay for it? So the latest and greatest solution functionality in the EMR may be exactly what you need to solve the problem that they're having, but there's no money. Maybe that solution functionality doesn't cost anything, but there's professional service hours that have to be paid for to have somebody from the vendor actually make a couple connections or turn it on. And who's going to benefit from it? So remember that if you're going to present any of these implementation changes, when you're getting leadership support, when you're trying to get somebody to buy into it, you always need to present an outcome. And if you can't estimate that outcome or that return on investment or value, then find some research that shows what other people have done as a return on investment or value. So you could say something like implementing this solution in the ER, this upgrade, could reduce left without being seen by 2%. We've seen that at 3 other clients. Well, 2%, if you see 30 patients a day, and I'm not going to try to do math really quick, but let's say that's 3 patients a day. Let's say the average ER bill is $1,000 a visit. That's $3,000 that you prevented from walking out the door of your hospital. Not that it should be about money, but I'm trying to make some simple examples. Some other returns on investment and value can be reduced mortality. So if you turn on some functionality that helps identify early warning sepsis and prevents people from dying from sepsis, if you can improve that, reduce the mortality rate by 25%, that's how many lives that have been saved. And that will eventually equate to dollars for your organization. So who benefits? The patients benefit, the organization benefits, the providers benefit. So you need to sell it to whomever is responsible for allowing you to go on with this project. Workflow and culture, resistance to change, we talk a lot about that. Understanding their workflow, adapting to their workflow, helping them improve their workflow, and the fear of the loss of the old ways of doing. And simply turnover. It doesn't matter if it's healthcare or any other organization or industry. Just when you get somebody trained, they're going to leave and you're going to have to go through it all over again. Some strategies for implementation road mapping are the 3 T's. So again, you need to get a good team. They have clear goals, they're champions, they're on board with you, they're the glue that holds the rest of the team together, they've got the respect of their teammates. You got to have tactics, so plan. Design your workflows. Tactics and strategies don't go live on a Monday. Don't go live the day before Christmas. I mean, consider holidays and summer vacations and weekends. Think of those kinds of things when you're strategizing. And your technology, don't skimp on it. If everybody needs an iPad, then order 10% more if it's in the budget, because somebody's day one's going to drop one, break one, forget one, take one home, whatever. So make sure that you go through the testing that's necessary for your technology, that all the connectivity is tested, and test your various scenarios. Some other strategies, and I'm going to highlight like psychological. So discuss the usefulness. Make sure you have a trial period. Ease into it so it gets people used to it. Start with voluntary use if that's permissible. So there's some other strategies to implementing any process improvement. Another method is design patterns, often used in software engineering or architecture, where when you start to see a pattern, so certain situations, they start to fall into certain patterns. You keep a library of those patterns and how you addressed those situations, and then you can reuse those on situations as they come up in the future. 10 Commandments. You got to have speed. I'm going to highlight the respect of physicians' autonomy. So remember, when they're resistant, sometimes they're afraid of their own licensure. So just because the organization pays them, or they may be an employed physician, they're still responsible for their license, and they're still the one that could be sued if something negative happens to one of their patients. So respect people's autonomy. And again, your teammates, uncovering long-standing process flaws. Just be aware that people been working in the organization 30 years, are used to doing something the same way every day. They can do it in their sleep. Even if it's a lot of steps and your way is easier, they've got this one down pat. They're going to be resistant. Some toolkits, some of these are antiquated. They are back from the early 2000s. However, they do give you some very good information on steps in being able to implement process change. So again, think about why systems fail. Think about what the critical success factors are and how you can measure that success. So make sure you have a current state so that you can compare that to a future state, and then the actual future state. So be sure you can run those reports or get that data after the change has been implemented and compare them. Think of those challenges to adoption and integration using strategies like the 3 T's and the toolkits. And have a great day.